If you're feeling tired or drowsy and need to stay awake and alert, you may consider using an alertness aid. This medication contains caffeine, which is a mild stimulant that can help you feel more awake. It's important to note that this medication should only be used occasionally and should not be used to replace sleep. Additionally, it's not suitable for children younger than 12 years old. It's best to take this medication as needed, and the recommended daily dosage will depend on your individual needs. Always consult with a healthcare professional before using this medication, and be mindful of the optimal timing for taking it to ensure the best results. When taking this product, make sure to follow the directions on the product package or as directed by your doctor. It's important to take this medication only as needed, not on a regular basis. It's possible that this medication may be habit-forming, so it's crucial not to increase the dose, take it more often than directed, or take it regularly for a long time. If you suddenly stop taking this medication, you may experience withdrawal symptoms such as headaches or mental/mood changes. To prevent withdrawal, your doctor may gradually lower your dose. Withdrawal is more likely if you have been using caffeine for a long time or in high doses. If you do experience withdrawal, it's important to inform your doctor or pharmacist right away. It's also important to note that when used for an extended period, this medication may not work as effectively. If you notice that the medication is not working well, it's essential to discuss this with your doctor. If your condition persists, worsens, or occurs again, it's important to inform your doctor. And if you believe you may have a serious medical issue, seek medical help immediately. If you experience nausea, vomiting, stomach upset, trouble sleeping, or increased urination, it's important to let your doctor know. However, many people using this medication do not have serious side effects. Let your doctor know if you experience dizziness, mental or mood changes, shaking, or fast/irregular heartbeat. A serious allergic reaction to this drug is rare, but seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. Remember to contact your doctor or pharmacist if you notice any other effects not listed here. Before taking alertness aid, it's important to talk to your doctor or pharmacist if you're allergic to caffeine or other xanthine drugs. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's best to discuss this with your pharmacist. Additionally, be sure to inform your doctor or pharmacist about your medical history, especially if you have heart disease, high blood pressure, stomach/intestinal ulcers, or mental/mood disorders. If you have upcoming surgery or medical procedures, it's important to let your doctor or dentist know that you're using this medication, as it may interact with other products you use. For older adults, they may be more sensitive to the side effects of this drug, especially trouble sleeping, so it's important to monitor this closely. During pregnancy, it's important to only use this medication when clearly needed and to discuss the risks and benefits with your doctor. If you're breastfeeding, be sure to consult your doctor before using this medication. When taking an alertness aid, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Also, avoid consuming large amounts of caffeine or chocolate while taking this medication, as it may raise your heart rate or blood pressure. Additionally, it's important to inform your pharmacist of all the products you are using, especially cough and cold products, diet aids, or headache medications, and ask how to use them safely. It's also crucial to be aware that this medication may interfere with certain medical/lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you are using this medication. As for the best time to take this medication, it's recommended to follow the dosage instructions provided by your doctor and pharmacist. Be sure to consult with them before starting, stopping, or changing the dosage of any medicines. If someone has taken too much alertness aid and is experiencing severe symptoms such as fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a local poison control center. Symptoms of overdose may include stomach or abdominal pain, changes in mental state, seizures, and a fast or irregular heartbeat. Make sure to keep all of your medical and lab appointments. This is important for monitoring your progress and making sure the medication is working effectively for you. It also allows your healthcare provider to make any necessary adjustments to your treatment plan. This medication is used to help increase alertness and decrease drowsiness in individuals who are experiencing fatigue or sleepiness. It can be used by people who work irregular hours or who need help staying awake during the day. The recommended daily dosage is usually 1 tablet taken with water. It is best to take this medication in the morning or early afternoon to avoid interference with sleep at night. It is important to follow the instructions provided by your healthcare provider or on the product label. Make sure to check the storage information on the package and keep the alertness aid away from light and moisture. It's important not to store it in the bathroom. If you have any questions about storage, make sure to ask your pharmacist. Also, remember to keep all medications out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.